Welcome to the Compromise to Alchemize podcast, and I'm your host, Dr. Neil Bolchandani. All right, well, Dr. Josh Madsen, it's amazing to have you here. It's been awesome to get to chat to you. So just for those tuning in, a lot of people out there know you. For any of those in my world with my audience who doesn't know, this is Dr. Josh Madsen, a fellow chiropractor who does so much to help families, huge focus on pediatrics, and all that. Josh, go into a lot more of that, but I just am so impressed because people that I collaborate with in the airway fields, they rave about you. I know Dr. Zaghi sends you families when they need intensives. I know many others do. So just like when I've seen what you put out there in terms of your education and then the work that you're doing with lasers and just journeying with these families with whatever they need with neurodivergence and beyond. I just know that's like a massive need in this world. So thank you for what you do. Welcome to the Compromise to Alchemize podcast. We'll dive in, but I wanted to just give you a chance to jump in.
Well, I'm excited to be here. Thank you. And I think it's going to be a fun conversation of talking about, not only neurodevelopmental stuff, but, just how airway plays into that and how body work plays into that and how that affects the brain and stuff. So, but I'm Dr. Josh Madsen. I own Infinity Functional Neurology, soon to be rebranded to Infinity Neuromotor Development Centers. So we have our main location is in Iowa. And then we have a practice that's open in March in Minneapolis and then in Denver this summer. So we'll have a few different practices and just trying to spread our reach and help as many kids as possible. And we work with a lot of kids. Probably over half of our population is kids that have autism, nonverbal autism. The rest of them are genetic disorders, traumatic brain injuries, PANS, PANDAS, autoimmune encephalitis, and learning difficulties. Those are another really common group that we see. And we work with them through just normal neurological development. So we work on a lot of primitive reflexes, balance integration, ocular integration, and most importantly, making sure that they have the energy needed for their brain to develop and mature. And we use a lot of different therapeutics for that. So, which we can dive into any of those different fashions for sure and get a lot deeper. But overall, that's what we do. And our practice started out of, a general chiropractic office. And now we do a lot of what are called intensives, or what we call intensives, where we see a kid for 2 to 4 hours a day for a week to a month straight, depending on the challenges they have, and really try to make as big a difference as we possibly can in their life in a shorter period of time. So that way they don't have to do therapy ongoing for months and months and years on end is really the goal when we're seeing a kid.
Yeah, I love that. I remember you had a Minneapolis, right? Minneapolis location coming up, but I hadn't recalled the Denver. So that's amazing. Just I know people come to you from a lot of places, but it's really amazing that you're putting teams in place in these different locations so that you can reach. And I know Denver, there's so much of an awareness of body work and somatics and all of those things. But you have such a, I'm sure, like so many people know, you have such a integral part of the puzzle of using such an extensive knowledge in like essentially functional neurology. But whatever words that you'll use for that are, as chiropractors, the way the brain works and the nervous system functions, and then going into these special areas that, I guess you could speak to this too, but it's like where it once was like not as known about, or not as, for sure the solutions weren't as known. Now it's like there's so much more awareness growing that it's such a need to tackle a lot of these issues, from the energy, from all the things like thyroid and all those areas that you mentioned, to helping these families with autism and through the spectrum of those disorders. So man, I'm excited to dive in, like you said, deep to some things in there. So tell me, when you went to Palmer? When did you graduate?
I graduated in 2016. So we've been open a little bit over 8 years now.
Yeah. And I mean, boy, what you've done in that amount of time is nonlinear in and of itself, because, you didn't just like get out and practice and start building your practice. You're building multiple, but more than that, I think like we see, like I see as a parent of three kids and knowing so many families that I get to journey with, that there is this scaffolding that's in place of what you've put out there of like answers for that. And I mean, for me, I'm personally like a massive fan of chiropractic in its like sort of fundamental origins with, we went to Palmer, right? And
Mhm.
that's amazing. And then if we look back at some of the history, they were doing so much more in conjunction, whether it was in their clinic or with adjunctive care, way more than just than chiropractic adjustments. So with what you're doing, I feel like this is the array of tech that's and knowledge that we really need to mitigate environmental factors that have been set in motion so long ago that are kind of reaching some of the like an apex of effect on our bodies. So can you speak to, man, anything you want, but those epigenetic or those environmental factors, or like why do you think what's going on, and kind of like what's your take on how we're at the place that we're at with such a need for all these things?
Yeah, yeah. That's a massive topic, right? But in a simplistic term, this is from the research that I've done, and there's obviously more out there. And everything we do in our clinic is based off of research. And the kind of the principles when I bring something to my clinic is there has to be a lot of research behind it. There can't be any side effects or extremely minimal side effects, right? Like mild headache or something like that.
Right.
Um, and it has to be effective. And then when I bring it into my clinic, it has to be super effective, or else I'm not going to do it.
Yeah.
And so if it follows all those three things, then we introduce it. And what I've found is that the more I focus on like mitochondrial health and energy production, the better and better and better these kids get. And I recently posted on our YouTube channel a longer video on mitochondrial function and autism and like the current research. It was a nice big analysis, almost 400 citations, and it talked all about the effects of how really the underlying contributing factor for autism and developmental issues is a mitochondrial issue or an energy production issue. And that comes down to, all the things that have start to affect our mitochondria is our environment, our current environment, like for example, pesticides and herbicides and autoimmunity and thyroid dysfunctions and blood sugar dysregulation and anemias and all of these things that literally all these kids have. They all have autoimmune issues. They all have, when we run toxic burden tests on them, they all have environmental toxins and heavy metals and mycotoxins. And these are all things that have been shown over and over again to dysregulate mitochondria. Well, then they don't produce mitochondria, or they don't, the mitochondria don't function appropriately. So they can't produce energy. So that means their nervous system can't develop because they don't have enough energy for it to develop. And that's when you start seeing neurodevelopmental delays or delay in normal neurological development. So we're going to see, as a hallmark of that, we're going to see primitive reflexes being not inhibited or being retained. We're going to see balance issues. We're going to see eye tracking issues. We're going to see cognitive delays just simply because we don't have enough energy for the brain to develop. And that's where a lot of the dietary changes and breathing changes and come in. But then also on top of that, there's things like that have been developed tech like photobiomodulation has been shown over and over and over again to upregulate mitochondrial function and produce more ATP. Hyperbarics helps get more oxygen in the system so we can get more ATP and energy. And that's exactly what we find is as we integrate more of these therapies that upregulate mitochondria or improve function of mitochondria, the kid gets better. And then we can start working on those developmental sequences.
Yeah, that's good. Well, way to take like a massive topic and to distill it, but it's also really amazing to hear like your protocol, and like obviously you exact a lot of excellence on yourself. I mean, and what you do, because I know you care a lot when it comes to taking care of people, just because you care because you're like that's who you are. I want to go like 70 different directions right now all at once, because I'm like, man, I want to touch on like some of your history and why you got into what you do.
Yeah.
Although I loved to watch, you have videos out there, which I love. I mean, so just, those are things people can look at, but I'll come back to that. Um, and then I'll say, oh man, yeah, just like the efficacy of photobiomodulation and cold laser is so good, and it just keeps getting better, the
Yeah.
data. Um, in all the ways I can help. I mean, and I know you have such an emphasis on these children, and I was like, right away, who did I tell? I'll just tell you, I told like three people very recently. I told Sarush Sagi, I told Eric Galindo, who's a pediatrician in Mexico, who's in the airway field, and Renata Nama at Airway Circle. I'm like, hey, I'm gonna be talking to Josh, and they're like, I love him. They just love you because of what you do and what you know. So Eric Galindo is he kind of zoomed in to present at a training that I did recently, and he's a pediatrician who really got fired up because of your discussion on primitive reflexes, and I love that because first of all, you know how rare it is for a pediatrician to get into that.
For
And then
sure.
he's getting into tongue tie work and releases. This guy is amazing. So I just feel like people are flocking to kind of like answers for these solutions for these situations that feel like they're like mountains to climb,
Yeah.
and it's hard to have enough proverbial oxygen to climb a mountain on your own. So you need support, you need people to journey with, and you are that. So I don't know. All of a sudden, I'm like you're like a guide who takes people up mountains and then helps them realize, at the end of the day, that's the mountain was hard, but you got a whole life ahead of you. So I guess that's like the most natural segue. I know you've shared like you came from a really challenging childhood with sickness and over again. I know if you could touch on that, like maybe
Yeah.
give us a 1 minute version of that, knowing that you have awesome content out there about that. But like name just if you could, like, were there a couple people for you who were like instrumental in that journey?
Yeah, yeah, for sure. So I had a lot of learning issues when I was younger. I had, attention issues. I had eye tracking issues that I didn't know about at that point, right? And I still am not a fast reader. I love to read, I love to learn, but I am not fast at all. Um, and and then I got, on top of that, I got diagnosed with a primary immunodeficiency. So a scenario where I wasn't producing enough white blood cells, so I was getting sick all the time, and about every month I'd have some kind of sinus infection or some other infection, I was still functioning at a pretty high level. Like I was able to run collegiate track and D1 track, but it got to the point where my body just got so burdened, so I was doing IVIG and I was doing all these things to try to stimulate my immune system. And then, during that process of getting adjusted and whatnot, what happened was I actually injured my back, working out and whatnot. And so I started seeing a chiropractor regularly. He's like, "Hey, you need to come in every week and every 2 weeks." And then, but what I ended up figuring out was as I did that, I stopped getting sick. Like I went like 6 months without getting sick, and I was like, "This is awesome." And at the same time, I changed my diet and I made different changes there too. Um, but that's what got me really interested in chiropractic was not only the effect of like my body doesn't hurt anymore, but then my immune system changed dramatically. And I still had low white blood cell counts for a long time. And come to find out now, I figured out that it was from a mold toxicity,
Mm.
but that trashed my immune system. But no one found that. And I didn't figure that out for a long time. Um, but anyways, as I've continually changed my diet, like, now my white blood cell count is normal. But it's taken a long time, and it's a lot of stuff I had to figure out on my own to do that. But if I would have known a lot of the things that I know now, or if someone would have known those things when I was a kid, I wouldn't have struggled with the same things. So,
Yeah.
that could have been fixed very early on, pretty easy with what we know now and the testing we have now.
Yeah, so you kind of like, I mean, in a lot of ways, you had to like dig deep to figure things out and dig yourself out of like some of the kind of condition or the place that you were in. So
For
no
sure.
wonder I feel like you carry a lot of like strength, like it's just built in you. You have a lot of tenacity about like pursuing what's going to help other people. Undoubtedly, like that's got to come from your personal journey. So
For sure.
yeah, do you like how does that play in like when you're with like especially as you started or even if when you get some people to come and you're like because I mean I know you like people come and they've been through their whole like what have they been through before they come to you, right?
Yeah.
And then they come to you and thank God a lot of people find like such relief, such healing, such marked change. So there's that. But like yeah, when you're seeing a family and you're like what's going on and you're trying to figure out some of these things, what really comes into play? Like how do you where's the tenacity and what motivates you, or like how do you stay in like to really pursue what the answers are? Because that's not a quick few minute adjustment. That's like how do you journey in those places?
You know, it comes down to, I tell patients all the time, like, this is not rocket science. Once I've learned this, everything, it's like, well, that makes perfect sense. Like, this is basic. And what I find with all of these kids is they have a lack of energy from some reason, from maybe it's toxic stress, maybe it's mold, maybe it's, whatever it may be, right? Or chronic infections. And if we can start addressing those basic things and get some of those things tested and figured out, like, okay, that's pretty basic. Let's work on that. And then developmentally, they have things that should have developed at 3 months, 6 months,
Right.
8 months that still aren't developed. And the kid's 8 years old. Okay, well, your brain's not going to develop. Your immune system's not going to develop appropriately. All these other systems that your brain controls, which is literally everything, isn't going to function or develop appropriately. So if we can just work on the basics and get rid of the reflexes, get their balance integrated, get their eyes moving better, and, I don't care what a kid comes into us with. If we work on those things, they're almost always gonna improve dramatically in some way or another. Maybe it's not what they came in for. Maybe it's a kid that has something going on and they have, 7 things going on, and we help them and they improve in 6 of them, but 2 of them don't improve. Like, I don't that's not, my goal. My goal isn't to treat their symptoms. My goal is to help them develop. When we do that, all types of things change, and then over time, all these other things start to change as well, and all of these functions start getting easier. But it's really just going back and looking at what's the foundation of development. What are those pieces that got missed? And when you can do that, they're usually pretty basic. When you can do that, the kid starts to develop. Then you can jump into more complex stuff. But most of the time, 90% of the time, it's they miss some foundational developmental stages, or they have some foundational metabolic issues going on that just need to be addressed, or dietary stuff.
Yeah. That's so good because you keep coming, or like you're returning in your like the way you see these. It's like there is the understanding, and when you figured it out, or when you saw how to help, it's like it can be simple in that way that you can execute those principles of healing, and just bring it back to where they have the chance to go through healthy development
Right.
when you get to them where they
And
didn't
start
get to
all over and
before,
get through
which
it. Yep.
which I love because it's so many times people say, "Is it too late?" or "Did I miss this? Did I miss this milestone?" I'm like, "Yeah, I mean, of course, they're that they're asking because they know, but that doesn't like they're like they want hope, right? So they're like, it's not." But I'm like, it's not too late. We can always do things to help. If I'm with an adult with they never integrated those reflexes, I'm like, we can do a lot to go back and regain so much.
Yep.
But like to your point, with you, like if only people would have known how to help you earlier, you could have had such gain to those years and quality of life, not just
Right.
quantity.
Yep.
So with the families that you see, like of course, 100%, like to get to these people when they're still a little informing, it informs their whole life. And I think of one woman that I saw after, and basically she was, she had maxillary split, split her maxilla to widen her palate. It was an amazing surgery, amazing by a really renowned person, and it was amazing. And had all these things like a tongue tie release by another amazing person that we know. So those things were good, but then she came in years later to, and let's say Dr. Zagi referred her to me saying, "I've thought of you because of what she's got going on." Thank God he I was so happy that he did because even though she was in her mid-20s, and even though the surgery she had had, like, well, yeah, I guess she was upper 18, 19, 20, something like that, maybe. Anyways, she wasn't integrating pretty early in the appointment. I could tell. That's why I did a 2.5 hour session with her, so I have time to check on those things. And clearly I was like, we need to access the brain. And so I used violet light through the maxilla, and I adjusted a bunch of other organs. And she, after that appointment and the next one, had like the prosopagnosia and the memory loss that she was experiencing. Uh, a ton of it dissipated, and she regained much healthier brain function. So I think like all that you do with photobiomodulation is massive because I feel like it brings people that have been through a lot of processes and procedures and wonder, am I going to have to do something extreme? It's like, well, thankfully we have light.
Yeah.
Light is so amazing, and it's so gentle, and it's so nourishing, and I love that.
And a
Um,
huge benefit of that is especially with like kids with autism is it's easy to do for them.
yeah,
And it's been when you talk about Violet, man, Violet's been a really cool waveform to start using. I found some research. It was on mouse model, but it 100% rings true to what we see developmentally is it was shown to increase GABA in the brain, which calms the brain, so calming neurotransmitter. But it also increased density of what are called Purkinje cells, and these are cells inside the cerebellum, and they help regulate sensory information coming in. So these kids that are really like hypersensitive to everything, they're really overwhelmed really easily. It's a great waveform to use for the cerebellum, and also it calms their brain dramatically. And we use that at the beginning of their intensives a lot to calm their brain down because a lot of these kids are, maybe they're have behavioral dysregulation, maybe they're violent, maybe they are hitting, kicking, screaming, all that type of stuff. But by the time we get to like Wednesday of the week, they're calm. They'll start following directions. They'll start doing other stuff. And they'll start, since I started integrating Violet, nonverbal kids that are nonverbal, they start speaking at a extremely high rate in comparison to what I was doing before. And that's been really, really cool to see. So Violet is an awesome waveform to start using for people that,
yeah.
especially if you're working with kids with autism, you'll see some really dramatic changes in how they're regulating and calming their anxiety so they can start opening up and start communicating verbally and non-verbally more appropriately. It's really quite cool to see when you start using that.
Yeah, I think it's massive. That's so pivotal. I think so like the research you brought up, and also just the way that wavelength. I mean, all the wavelengths are good, right? We need them all in some way, but that violet light just really stills that hyper arousal, that sympatheticonia, that system that a lot of people, especially now, are finding. Everybody's talking about the vagus nerve, and everybody's talking about how do I find regulatory practice. Sometimes breath work is amazing. Like, shout out to Renata as a myofunctional therapist, and all the other amazing people, like just going to shout everybody's name out all of a sudden. But all the breath workers, they're doing such great work, and yet at the same time, we sometimes need to realize, like, I look at these things like light as nourishment. We need nourishment before we can get into some of these practices, and because sometimes we're just huffing and puffing without proper breath work if we're working with a hyper aroused system.
Yep.
And so the kids you're talking about, they're starting with that, and they haven't had a chance to come down to allow those neurotransmitters to function at the level to what would facilitate way more expedient healing. So what's brilliant, I love that you like, I use violet on most as like the primary form of light. Everybody comes asking about red, and I love that, or infrared, and I love that. And I'm using other colors, but the violet is good. I have that one. Maybe I told you this, but it was like there's like two cases maybe out of five that really stand out. But the most recent one, the mom who had a second tongue tie release for her little baby because the first one just reattached. And anyways, she came in, and she was worried about that, too much tension under the floor of the mouth, under the tongue. And this is going into your work too. It's because the little girl had some sensory processing issues, particularly with sound, but also in this case, I picked up the one with smell. I used the violet light intranasally to work on the cilia, and after that, it decoupled the sensory exacerbation, and the floor of her mouth loosened on the left without me needing to massage it, which for any mom or any parent or any person, thank God, we just don't want to have to dig in when muscles don't need that. It's like if you can use light on tissue to create change, how amazing. And I love also, I'm gonna mention this too, just because some people are gonna be like, yeah, we love all this, but you make it pretty like available for parents and families to get lasers, and you show them how to use it. Can you touch on, like, I know that's a big motivation for you, or motive, or you just want to equip people, and you want people to be able to have healing at their own hands. Tell me about that, and like how that started for you, how you started to implement that and recommend it to people, and tell me more.
Yeah, yeah. So the when it comes to research on autism and delays and and in lasers, there's some really cool stuff out there, and I think in the next 10-15 years, I think it'll be one of the main therapeutic approaches for autism because
Yeah.
when you break it down, I mean, it addresses many of the underlying factors that we know: the gliosis, the neural inflammation, the autoimmune issues, um, it helps with neuronal pruning, it helps with neuronal growth, stem cell activation. Like, I mean, it does a lot of cool stuff, but according to the research, and it's a tool that every parent with a kid with really severe delays can do very easily, and it makes a really big change. So it's something they can do at home every single day. And yeah, so we help them with that. So they do, if someone ends up purchasing a laser from us, we send them an at-home exam, kind of like a express version of what we do in the office, and we have them do it the best they can. They record it, and then we watch. One of the doctors watches it and makes a plan based off of that. Of okay, these are the brain are involved. We're gonna have them laser this and this and this, and then part of it has to do with their symptoms too. Like if they have speech delays, we're gonna be hitting different areas based off of that. But that's kind of how we make a plan for it. So that way we make sure that they get it, but they know where to do it. Number one,
Mm.
how long to do it, and then me and Dr. Lauren, we're making a course right now. It's almost done. We're going to teach providers how to do transcranial photobiomodulation and talk about the different lasers that you need and the strengths you need and stuff like that because there's a lot of research on it, and there's you got to have a powerful enough one to get through the cortex. It's a thick bone, and to really have an effect on that neuronal tissue. So there's a lot that goes into it, but yeah, we teach parents how to do it so that way they feel confident at home, and make sure that they're not doing too much, not doing too little, and it's just the right amount.
Yeah. Oh, that's awesome, man. I love it. Yeah, I think it's like a pretty um, pretty beautiful like process that you can bring somebody on when I think kind of at the core of some of what you said is when you put healing into people, when you give people agency and like resource them, like first of all, that's huge because who doesn't need that? Who doesn't want
Right.
that? But also like how many people, it's not as viable that for them to come in person or to even go to a local person. You get them like what you're doing, and that is just multiplies, and they can use that, of course, for multiple kids
Yep.
and
And themselves and everyone
themselves.
involved. Yeah, yeah. I
Yeah,
use them. I use the laser
laser
almost every
parties.
day. Yeah.
Yeah,
And it is cool. It's really interesting to see the difference when a kid comes from an intensive. They do great, but the ones that have a laser at home, it's really cool to see the long term effect that has of using a laser consistently over a 6-month period. The effect that has on the nervous system is unreal. I mean, they come back looking like neurologically looking at like completely different kids. It's really really cool. And so it's for us, it's a really valuable thing to send home, especially if they are expensive. That's the sad reality is for a good one that can get it's strong enough to penetrate. They're
yeah,
not cheap,
yeah,
but they're getting better. They're getting technology's getting better. They're getting easier to make. So hopefully in the next 10 years they're a lot more cost effective for families. Um, but it is a wonderful tool to be able to use at home for sure.
yeah. Well, I know we'll have future conversations, but I'm excited to dig into some of that with you, just with what I'm working on with protocols for airway feeding, and I just feel like there's too much, and there's whatever I know. If we combine, if we combine some
Find
intel
that
on,
knowledge.
yeah,
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 for
that's
sure.
gonna be so good, because one of the things that I'm gonna say it because it's like I'm a big fan of there is no cookie cutter because every family is different, and yet at the same time, like what you're doing and what I'm doing, like meaning we I want to help families and I want to help people that, I recommend different resources and tools and it's like a protocol with that because otherwise they're just running around with no plan,
For sure.
um, um, and and so the reason I prefaced what I'm saying is because I'm like it's almost it's without fail almost if I can't even think of in the airway feeding, and I say airway feeding because that's a subcategorization of what happens when the fourth, fifth week in gestation embryologically, we have issues in the pharyngeal arches where they don't develop correctly, and we can have things like, airway issues, right? So, but it's not really, it's not just relegated to airway. I like to bring lactation, and we first start with feeding. We get oxygen through the umbilical cord, it's a nourishment, it's feeding. So we tongue tie or lip tie or cheek ties or maxilla that's narrow or the palatine bones that are askew and not aligned, and then we have what about the mandible, and is that too narrow, and is the lower arch the upper arch, and we have anything even throwing in there mandibular tori, and we can have these bony growths that happen, or maxillary ones, and I see these on infants coming into the world, and that's crazy because they used to be talked about as things that happen through clenching and grinding over decades and over years. And I'm like,
Yep.
yeah, but babies don't come in with that. It's epigenetically transmitted through the family line. But to get off that rabbit trail, or it's
Well, to go back into that, I'm really interested in understanding a little bit more about why that happens in the first place. And maybe maybe you don't know, maybe no one knows. I don't know the answer to that. So that's a question
yeah.
for you as you keep going through this.
Yeah, I think it's a big topic. There's a lot. There are people poking and prodding at it from a lot of different angles, and I'll kind of tail end what I said before and then jump back into that from what my perspective, anyways,
Yep.
is that with it often when I see those who have marked significant airway feeding, but I have a study club that I formed called Air STEM, because the brain stem's so important. But I think with all of us who have air stem issues, it's like tongue tie, all the things that I mentioned. It could be issues with speech. It could be issues with, um, you know, movement. It could be issues with, you know,
Yep. Cervical
just
restriction and just
cervical
overall movement
restriction.
development. Yep.
Yeah. And sleep, eat, move. That's the little acronym that I use. Sleep, talk, eat, move. Those areas are affected, and way more. Um, and of course, like, I have so many people come in and they're like, "I'm convinced that the tongue tie is causing my kid's speech issues," and I'm like, "Let's look deeper." Just like you do. It's like, yeah, actually, what's going on is there's no bihemispheric communication in the
Sure.
corpus callosum, and so we use monatomic elemental gold. And I say, if you supplement with gold and some light therapy, that was dramatic for certain cases. And because I'm like a big fan of saying, let's just see if it's something else before you go to a procedure that might be helpful for structure. We don't know if it's going to change function. And I think by now there's enough experts in the airway field that say, yes, we can't just go doing all these procedures willy-nilly unless we. So I love to do deep dives on people when they come in. I'm so happy when they're like, I'm convinced, or should I be convinced? And I'm like, nobody should be convinced right now. Let's just take some time. And so for a lot of these ones, we do like very intricate exams, and I do think that there's so much to it, but I love violet light as a way to get through. And so coming back to that, I feel like there's a lot of those kids, if I use red light right away, it raises their sympathetic response
Yep.
prematurely, and then it often tightens their floor of the mouth. And with what I do, I'm usually sent people who, whether they know it or not, their main goal is, how can I get the floor of my mouth looser, baby to an adult, because that's been the complication. And so I look for how to do that, because when I do that, that opens up a whole world of them from head to toe, and all the 70 points that I've defined that are involved. And then I'll jump to the one comment on, yeah, a lot of people say it's vitamin A is the reason for MTHFR or tongue tie and methylation issues. And then a lot of people say it's the fulvic acid issue. A lot of people say, and I say, let's go broader and let's say, who knows? But we can name DDT as being still found in the swamps in Florida, even though it came from California. There's DDT, pesticides, heavy metals, parasites.
It's
We
all the
can name all the.
environmental factors.
What's this? Go ahead. Sorry.
Yeah. So yeah, all the environmental
Environmental.
factors. Yeah. That.
We could name all of those, and then um, still we have the people in my kind of, one of the other fields that I love to be in, at least with one toe, is the pre and perinatal psychology field, and those who practice birth psychology, but more like somatic practices to help babies to adults go through and heal from issues they had. And there's so much data out there. APA is an organization, the Association of Pre and Perinatal Birth Psychology. They have a lot of so much evidence that shows how cogent and cognizant that little gestating beings are. So we can say that influences from the mom, influences from the grandmother, the great grandparents, and up the line, things that happen in their lives, stresses, physical or emotional, they can influence, of course, embryological development. Just so I think my opinion is there's a lot. It's
For sure.
hard to identify exactly where, although I like to problem solve that. But what I do know is that it's so clear that the way that these are manifesting in people are coming through at such an early phase, but it's not too late. Like, you can help people so much by delving into some of those things. And I love that you do that with, primitive reflexes and other forms of development. So, yeah. So I just threw out there some of my thoughts and opinions, but I'd love to have you jump in and share your thoughts on any of that.
Well, I don't know. That's why I asked, because I don't know the answer to that one. Like, because you see now, when you see patients, you see tons of tongue ties, lip ties, and I've heard the same thing on methylfolate and all those deficiencies and those types of things as well. MTHFR mutations and midline defects and that type of stuff. And for sure, we see a lot more of it, but and I don't know what percentage of it's populated in adults, and why it's now such a huge thing. And I figured you may have had that answer. Or if anyone did, you probably did have that answer. But but it's interesting you talk about all those things like those environmental toxins, and we see that over and over in the research with kids that have delays. Is these toxins are really what they're what's the right words? They're not causative, they're correlative, right? Like,
Yeah.
so there's correlation between all these things and higher prevalence
Yeah.
and that total toxic burden of the overall burden of toxins, the higher it is, like, a body can adapt to a certain amount, right? So it can adapt to one toxin or two toxins, but once you start getting to a certain level, you don't have enough antioxidant reserves to quench that, and you start having a lot of issues. So, but it'd be really interesting to see if that's the same mechanism involved, which would be very interesting because I mean MTHFR is very common. What 40
Yeah.
something percent of our population or something like that is MTHFR. So, um, but I don't know if 40% of our population has tongue tie, lip ties or not, or
Yeah.
some other type of midline defect. I don't
Well,
know.
yeah, no, I could say, through my own data and through, pouring over, talking to some who've been in the field for 5 decades. Um, and, I collaborate with a lot of these especially looking, if you take into consideration, not just the anterior, you know, ankylosing as the anterior tongue tie, then if you consider the posterior tongue tie, or what, some in the field, like, shout out to Dr. Zaghi and the Breathe Institute and others too, who have pointed out it's more of a mid tongue tie, actually, by definition, than it is to be called a posterior, but that's just an aside. So, and then often, if you have any of those, then that precipitates the increased likelihood that you're going to have lip and or cheek ties. And but um, there are very, like, let's say, nominal frental restrictions on some, yet they have, really significant arch issues with the narrowing of the maxilla. But
For
if
sure.
we take like just the tongue tie, just the ties themselves, I know it once in the past was called 2%. That's a woefully small percentage. I don't think that was ever accurate. But I would say that what I'm seeing and some others are feeling or finding are way more than 60% of the
Really?
population. Yes. And of course, I have a biased population now because I specialize in this. But
Yep.
if I go back to my records before I ever even knew about this, knew it existed, and the thousands of people I've seen and the practitioners that I've guided and the ones that they've seen, that it's probably, in the average there in 60-40, but we're coming up with what there's a broader characterization that's needed now. And I'll mention, because somebody could go undiagnosed with, like, say, no ties whatsoever, but for me, we have tongue space. That's the width of the maxilla and how that functions, and that could be the issue that doesn't allow a nominally restricted or normal tongue to elevate. So you have the effect of a tongue tie with that. But also, I've codified, or I'm calling floor space a major concern, because if somebody has significant mandibular tori and they occlude most of the floor of the mouth, then that oral diaphragm doesn't work, and that causes uh, airway restriction in many places. Of course, the airway itself, but then up to the craniofacials and down the whole body. So I think the prevalence is increasing from what data shows. And also, there are way more providers and practitioners who are trained enough to be able to observe and spot this. And that's why then there's now this amazing increase of people on Facebook forums who know about it, and people helping people versus having to rely on just practitioners. But I also mentioned something else that I see going back to your history with mold. I see a lot of transient airway issues that are going on where people that suffer from mold, even, well, some people say you can't suffer from a mild mold infection. I'm like, well, let's say the spectrum of mold, there's a severe, but I see people who their anatomy and their physiology, their diaphragm is fine, and they have good floor of the mouth and great suction hold. Their orofacial muscles and their head and their all these things are working fine. They end up dealing with a mold toxic reaction, whether they visited somewhere or they find that it's growing and they find where it is, and all of a sudden they go through transient airway restriction, not only with the breathing, but in these 70 points in the body. I find where the right sphenoid misaligns, their right temporal does, the that right shoulder comes forward, and the right psoas, and you could just too many places the diaphragm gets restricted. And it's like, I think some people also, more than the 60% that are, we could say, are coming into a data percentage now, functionally I would classify it as way more than like 75% are dealing with transient airway issues that, if not affected and helped, will cause the same kind of deoxygenation or hypooxygenation that could lead to massive issues. So I think it's a really good topic to go down a crazy rabbit hole on, because it's playing its role in the world right now. And I think there's one thing I forgot to say is, because the people listening, they're gonna be like, Neil, you never mentioned the anthropological concerns, right? So it's, of course, like breastfeeding went away, bottle feeding, normal palate expansion that happens through breastfeeding wasn't in place. So over time, we've gone to like not chewing as much, to eating baby food and smoothies, and then
Yep.
we've narrowed our faces that way. Sure, throw that in the mix, but I still think what we're talking about is way more foundational to what's going on.
Yeah. Yeah, for sure. Yeah, that book, what is that book? Jaws? Is that the book? I read that a long
James
time ago.
Nestor with Breathe.
Yeah, there's another book called Jaws too. I've read
Yeah,
both of those. Jaws talks a lot about those anthropological
yeah,
aspects of it too. But yeah, um, and it's really interesting, looking back on like developmental stuff and airway stuff and mouth breathing and your lack of nasal breathing and that effect on that vagal system of like when you're nasal breathing, you're getting, your chest breathing, you're not getting those deep inhalations, diaphragmatic breathing, you're not getting that vagal response. But something that's really interesting you see a lot in kids that have delays is they'll have poor blood flow, the
yeah.
hypocapnia. And again, a lot of times that comes back to that dysregulated breathing and sleep apnea and just different issues like that at night. And so that's another thing you see a lot. And again, it comes back to the foundation of we have to have oxygen for us to produce energy. So if a kid has a breathing issue, they're likely going to have some form of challenge or neurodevelopmental delay or attentional issues, especially if they have blood flow issues in their fingers and their toes. They're not going to get blood flow to the tip of their brain, which is their frontal lobe, which is going to give them attention. So if your kid's struggling with attention, make sure you are checking those things because it's a big deal.
Yeah, well, I know that there's a few questions I have for you, and then you please say anything else that comes to your mind. But I mean, especially just kind of like how you were contributing to what you said was, hey, if you're struggling home with attention with your kids, like I love what the kind of the message that you have, because you're not just healthcare provider. You got a family, your wife and kids, and you know what it's like to raise a family, and it's like there's a lot to that. What would be your like encouragement to families out there? You know, knowing what you know and knowing you have a family, you love being able to be a resource for your own family. But what's your like wisdom and message of hope just to families out there who might be in the middle of some of these things and need some of that extra energy?
Yeah. Um, so maybe if you follow me, you might know this, but my son had PANS from a mold toxicity. So, which was a really tough time,
Yeah.
screaming for 30 minutes straight. You can't do anything. You feel helpless. If you try to discipline them, it's even worse because you didn't realize what it was at first. Just it's anyone that has a kid that has PANS understands what I'm talking about. It's like they're not even there. It's just it's a really rough,
Mm.
hard time. Um, and so when your kid is struggling, always think of trying to figure out what's causing it, what's there, what's going on in the environment, because it's usually something environmental. And in our case, we ended up figuring out there was a mold issue. We had it was behind a wall. We had multiple different people come in and check the house. We couldn't figure it out. We're like, what is going on? Eventually ran
Mm.
labs on him at two and
Mm.
a half, and I figured out, okay, he has a mold issue. We still couldn't figure out where it's coming from. Eventually, we tore out a huge wall in our basement, found a crack in the foundation, a mold issue. Um, but there's almost whenever there's something big going on, there's almost always a reason, especially if it comes out of nowhere. Like there's always something that's going on. So monitoring your environment is really important, and changing their diet's really important. And um, we often, I think for a lot of families, like, oh, well, making this dietary change is hard, or making this change is hard. But I always just tell them like, what battles do you want to face? Do you want to face the
Mm.
battle of like, yeah, you can't eat that, bud, or do you want to face the battle of dealing with the behavioral aspects after, or the dysregulation after, or the sensory issues after? And but for example, for us, we moved out of that house. We put all of these things into place in our new house so that we don't have those same stresses. So, like
Mm.
for example, we put um, a ultraviolet photocatalytic oxidation system in our HVAC. So that way there's violet light that cleans the air as it goes through,
Mm.
so it prevents mold growth. We made sure that we had dehumidifiers to keep our humidity down so it can't grow. We put a heat recovery vent in to circulate air throughout our house. Like I don't have Wi-Fi in my house because our son didn't do well with Wi-Fi, so
Mm.
everything's hardwired. So like looking at all these little things, and for example, if we used different chemicals to clean the house, he would have responses after that. So we had to be really careful on what different chemicals were around the house and what was being used to, clean the toilets and clean the sinks and all that type of stuff. So always think back to if your kid's struggling, what are all these different toxic stressors that can dysregulate them, and figuring out what they respond to. There's a lot of things he doesn't respond to, but there is certain things that he does. And removing those is what's really needed to allow them to heal. And so, it's always important to go do therapy. It's always important to go do all these things, but come back and go, what is going into his body? What is going on to his body? What is he breathing in, or him or her breathing in, what's going on around you, and how can you clean up that environment? Because when you do that, you're going to take care of a big aspect of what's contributing to it in the first place. So that would be my biggest tip: is monitor your own environment and the things going into your child's body, because that's going to be by far the biggest effect that you can make long term.
Wow, that's good. Well, that's awesome. Well, way to go. I mean, sounds like you've definitely biohacked your house and done it with obviously a big need. So I know Ben's gonna love that when he talks to you.
Yeah,
Um,
not at his level though. The
hey
man,
man,
his
no,
we
he'll be
I
like
would have yeah I would have
he's gonna
bought.
want you to come and help him set up some stuff at his new home. So
Yeah, I would have built something, different, but we did a home birth, so we
yeah.
were in the midst of, like, my wife was pregnant. We're like, we have to
Oh
get a
wow.
house. So it was like we had mold inspectors come into the
Oh
house,
my
every house
gosh.
we looked at before we ever bought them, and all that type of stuff.
That's a lot.
And so luckily it took us 3 different offers, but eventually we found one that was clean and was in good shape. So
Well, that's your tenacity again showing up. It's tough to have like life circumstances, but it's really amazing to see. Obviously, like many people have said, what you've been motivated to do, and that you've been helping people, and And yeah, deep dives into neuroscience and anthropology. It's pretty good. So I'll look forward to future conversations and
For sure.
look forward to so much more. But yeah, I know you have a lot of people that know where you are, how to find you, and some of the stuff you're working on. But anything else you want to share about any of that before we finish?
Yeah. You can always find our stuff on short form stuff, Dr. Josh Madsen. If you look me up on Instagram, I'm there. On YouTube, I do long form stuff. So longer videos, a lot more detail. You can look my name up there, or Unraveling the Brain. That's there. And then drjoshmadsen.com is kind of my main one. And that goes to books and courses and things like that I offer, and then also links to our clinics. So if someone wants to work with us, that's a nice kind of little hub for everything.
Yeah, amazing. Well, thank you so much for sharing the wisdom, sharing the time, and I'm excited that whoever comes across through some of our conversation and what we've talked about, they'll find you have some just like really great answers for a lot of people that are struggling. So I appreciate you, and yeah, I look forward to the next time we chat.
I appreciate you as well, man. Thanks for having me on, and many more to come.
Yeah, all right. Well, everybody, you know where to find Josh. You know where to find me. This is the Compromise to Alchemize podcast, and just love for you to subscribe and comment below. Like, what did Josh inspire you to do or think or become in this episode? And stay tuned. We'll have more coming out soon.